entities. It is a spherical organization of agricultural professionals and related sectors in India. It provides a common platform for various agricultural professionals like professors, associate professors, assistant professors, PhD scholars, students, experts, and researchers working in various scientific institutions across India and abroad. Our next organizer is Acharya Narendra Deva University of Agriculture and Technology, which was laid on January 15, 1974 by Honorable Prime Minister of India, late Srimati Indira Gandhi at Masoda near Ayodhya city. On June 21st, 1975, by the government of Uttar Pradesh, decided to locate this main campus of university at Kumarganj, Faridabad instead of Masuda. After establishment, it was started teaching, research, and extension and has succeeded through graduate, master's, and PhD degrees by development of varieties and extension of technologies. Our next organizing um, institution is the College of Veterinary Science and Animal Husbandry, which came into existence on 26th March 1999. Since then, the college is tirelessly working for the betterment of the livestock sector by providing quality education and catering for the needs of farmers in the field of animal production. By providing its technical expertise for the genetic improvement of livestock and poultry, better animal health and treatment, etc., the college is playing a pivotal role in upgrading the livelihood of the farmers of the eastern Uttar Pradesh. College follows the minimum standards set by Veterinary Council of India for BVSC and AH education as it is mandatory for a veterinary college. The department setup for college comprises of 17 departments, including one livestock farm complex and one veterinary clinical complex. These well learned and up to date faculties shape the budding veterinaries of the college by providing the best quality teaching and counseling. Now, along with the organizing institutions, I would also like to announce the knowledge partners for this program. They are University of Toledo Medical Center, Ohio, USA, Florestan University of Veterinary and Animal Sciences, Bhavalpur, Pakistan, Lala Lajpat Rai University of Veterinary and Animal Sciences, Hisar, Haryana, Kerala Veterinary and Animal Sciences University, Guru Agant Dev Veterinary and Animal Sciences University, Ludhiana, Punjab, Shere Kashmir University of Agricultural Sciences and Technology of Jammu, Kamdhenu University, Gujarat, Bihar Animal Sciences University, Patna, Odisha University of Agriculture and Technology, Bhubaneswar University of Agricultural Sciences, Karnataka Jawaharlal Nehru Krishi Vishwavidyalay, Jabalpur, Rajasthan, University of Veterinary and Animal Sciences, Jaipur, Rajasthan, and Agrosphere e-newsletter. Also, I would like to congratulate the entire organizing team and their efforts for this insightful training program, which we will begin within a few moments. Sir, our guests have joined.
Yes.
Okay, so today we are highly privileged to have such honorable dignitaries among us. It is a matter of great pride that the chief guest for today's program is Dr. P.S. Parmanik Sir, Registrar Acharya Narendra Dev University of Agriculture and Technology, cum Dean College of Veterinary Sciences and Animal Husbandry, ANDUAT Ayodhya. Sir has joined us. I wholeheartedly welcome on behalf of whole the organizing team. We welcome you, sir. So here is to introduction of our dignitary. Dr. P.S. Parmanik sir is a renowned professor of veterinary field having 25 years of experience in administration, teaching, research and extension. He held several prestigious posts at university like Dean, College of Fisheries, Head Department of Livestock Production and Management, and Hostel's Warden. Sir did his bachelor's in veterinary science from West Bengal University of Veterinary and Fisheries Sciences from a National AD Research Institute, from Indian Veterinary Research Institute, Itanagar, Bareilly. Sir also joined the ANDUAT in 1999 as assistant professor and became professor in 2012. He has more than 100 publications and authored many books. He has been honored by different societies with various prestigious awards. Sir, your achievements are endless, and we are not able to enlist them all in such a short span of time. We are indeed very fortunate to have you on board. With these words, I would like to invite Sir for an inaugural speech. Over to you, Sir.
Am I audible?
Yes, sir, you are audible.
Okay, thank you, Surya ji. Good evening and namaskar to all. At first, I welcome and thank the organizer, Sri Jitendra Mehta ji from Vital Biotech and AFTEF Society for organizing this 7 days international training come workshop on future technology in veterinary science in Viksit Bharat through online mode. I also welcome and thank to all the honored speakers and participants of this training come workshop. Before we look for future technology in veterinary science in Viksit Bharat, we must relook the rich tradition of veterinary science and veterinary care, which was very much developed or Viksit very early in India. Ancient Indian literature in the form of Vedas, Puranas, epics like the Ramayana and the Mahabharata, etc., is flooded with information on animal care, health management, and disease cure. Books written by Charaka, Susruta, Palakappa, and Salihatra documented treatments of animal diseases. Several Indian laboratories still make preparations from ancestral recipes for the treatment of domestic animals. We all know that science finds and industry applies through technology. As technology continues to advance, new breakthroughs are coming. The way veterinarians diagnose, treat, and care for animals. Some of the promising advancements in veterinary science that have the potential to shape the future of animal health are like this: genomics and precision medicines, telemedicines and remote monitoring, 3D printing and prosthetics, stem cell therapy and regenerative medicines, artificial intelligence and big data analytics, molecular diagnostics, robotics and automations like surgical robots, robotic rehabilitations, wearable technology, and IoT app applications which give proactive health alerts in real time by remotely inspecting animals every minute. Then nanotechnology in drug delivery, advanced monitoring equipments like anesthesia monitoring, continuous vital sign monitoring, virtual reality for animal behavior studies, veterinary software solutions, etc., etc. I am sure different speakers will talk about this in details in their deliberations. The future of veterinary science is filled with exciting possibilities. These advancements of technology not only benefit the animal health and welfare, but also contribute to the One Health approach and safeguarding the human health by reducing the risk of zoonotic diseases and strengthening the human-animal bond. To revamp or revolutionize the veterinary industry in Viksit Bharat, there is need to explore the rise of veterinary startups in India by bringing innovations, accessibility, and efficiency to animal healthcare. And these startups are playing or will play in vital role in shaping the future of veterinary care in India. In India, the acceptance and integrity of new technologies into the existing systems or creating a new one is very difficult. This is another challenge. It is very difficult to convince people about the advantages of these new technologies. Technology adoption is the key to solving India's challenge to access to a more equitable healthcare systems in veterinary field. I hope in this training come workshop, the participants will be benefited a lot in the coming days, coming 7 days, regarding the newer technologies in veterinary science. I wish a grand success of this program. Thank you all. Thank you.
Thank you, sir, for your kind and enlightening words. Now, moving forward, today's keynote speaker is Dr. Rashmi Singh, Assistant Professor, Rajasthan University of Veterinary and Animal Sciences, Bikaner, Rajasthan. Before inviting Madam to deliver her lecture, I would like to briefly introduce her to our participants. So, Dr. Rashmi Singh has done her graduation from the College of Veterinary and Animal Sciences, Rajasthan Agricultural University, Bikaner, in the year 2006. She has done her post graduation and PhD in epidemiology and preventive medicine from Uttar Pradesh Pandit Deen Dayal Upadhyay चिकित्सा विज्ञान विश्वविद्यालय एवं गौ अनुसंधान संस्थान Mathura. She has served 3 years as a veterinary officer in Animal Husbandry Department, Uttar Pradesh. After that, she joined as an assistant professor in Department of Veterinary Medicine at Rajasthan University of Veterinary and Animal Sciences, Bikaner in 2014. She has worked in various capacities as in charge of Department of Veterinary Pharmacology, in charge of feed and fodder store in livestock farm complex, in charge of veterinary clinical diagnostic laboratory. She has also worked as a co-principal investigator in the Indian Council of Agriculture Research ICAR National Agricultural Higher Education Project Innovation Grant. Rajasthan University of Veterinary and Animal Sciences, Bikaner, Rajasthan. As teaching is the prime work area of a teacher, she has taken various UG, PG, and PhD and animal husbandry classes with utmost sincerity and punctuality. Students were taught with various methods like discussions, demonstrations, and PowerPoint presentations. Excellent classroom discipline management while maintaining a warm and cordial learning environment she achieved. She has guided 3 PG students and 1 PhD student as minor advisor from the Department of Veterinary Medicine As minor advisor, she guided 4 students, and then she has also published 22 research papers and 48 abstracts. Once again, welcome, ma'am, and please enlighten our audience with your knowledgeable words. Over to you, ma'am.
Thank you, Aishwarya ji. Am I audible? Am I audible?
Yes, ma'am, you are audible.
Okay. A very good evening to all. Honorable Vice Chancellor, Acharya, Narendra Dev University of Agriculture and Technology, Kumarganj, Ayodhya, Dr. Brajendra Singh, Chief Patron of this workshop. Patron for the workshop, Professor Dr. P.S. Parmanik, Dean College of Veterinary Science and Animal Husbandry. Organizing Secretary, Dr. Naveen Kumar. Course Director, Dr. Jitendra Mehta, and other persons from Vital Biotech and FTAB. Dignitaries present over here, Dr. Biju, Dr. Anil, and dear participants. First of all, I extend my sincere thanks for inviting me for this lecture in this seven days international training come workshop. I'm highly thankful for Vital Biotech and FTAPS and organizing team from Acharya Narendra Dev University of Agriculture and Technology. I'm going to speak on an emerging important infection of dogs, that is canine babesiosis. Slides are visible?
Yes, ma'am, they are visible.
So, babesiosis is an important hematoprotozoan disease of canines. It is caused by genus Babesia, which is characterized by hemolytic anemia, fever, splenomegaly. Babesia is the intraerythrocyte protozoa, and it belongs to the phylum Epicomplexa. First time this hematoprotozoan was described by Romanian biologist Dr. Babes in cattle with hemolytic anemia in 1888. Early description of this intraerythrocyte parasite in dog were reported in Africa in 1896, and in India, this disease is reported first time in 1910. It's a tick-borne infection. It belongs to phylum Epicomplexa, order Pyroplasmida. Genus is Babesia, and more than 100 species of Babesia have been described till now. And heart ticks are the main vector for Babesia infection. Various species of Babesia are Babesia canis, Vogelii, Babesia canis canis, which is moderately pathogenic, Babesia canis rosei, which is most pathogenic, Babesia gibsoni, Babesia conradi, Babesia microti, Babesia cabelli. Babesia species is divided into two groups. Large form of Babesia size is 3 to 7 micron, which are generally found in pyriform shape and exist usually single or in pairs. Example is Babesia canis, and small form of Babesia having the size of 1 to 3 micron, and these are also intracellular organisms found in single or in pair form in erythrocytes. Example is Babesia gibsoni. We see the life cycle of Babesia as the disease is transmitted by the ticks. When take the blood on the animal, on the dog, it spread the sporozoites from its salivary glands into the blood. From the blood, these sporozoites reaches to the erythrocytes, and erythrocytes mirogony occurs, and the daughter cell infect the new erythrocyte. These infected erythrocytes are ingested by knave tick, and in the tick midgut sexual phase of reproduction occurs, and the gametes form. These gametes fuse to form a zygote, and this zygote invade the epithelial cells of the tick gut, and asexual reproduction of occurs, that is sporogony occurs. This eukaryote can leave the epithelial cell. Either it goes to the salivary gland or it can move to ovary. From the ovary, it may go for the transstadial or transovarian transmission, or it may reach to the salivary gland, and again the same cycle repeats. So the asexual reproduction occurs in the dog, and in sporogony and sexual reproduction. Transovarian and stadial transmission is possible by the six developmental stages. For the various Babesia, like for Babesia rosei, transmissions occurs by the Haemophysalis elliptica, which was previously known as Haemophysalis leachi, and Babesia canis is transmitted by Dermacentur species, and Ripicipilus sanguinus species, brown tick Babesia vogeli, which is moderately pathogenic, is transmitted by Ripicipilus sanguinus. Babesia gibsoni is transmitted by Haemophysalis longicornis and Haemophysalis bispinosa. Other non-vector transmission can also be possible between dog to dog. It may be possible via the fighting between the dogs from the infected dog and susceptible dog. And it is also possible through congenital route, through birth, or route is also possible via the transplacental transmission is also seen. Pathogenesis of the disease. Pathogenesis of the disease depends primarily on the which species is involved and which strain is involved, and also depends on the host, that is what is the age of host and what is the immunologic status of the host. Multiple mechanisms appears to account for the pathogenesis of babesiosis. Parasitemia results in the erythrocytes become cosmetically fragile, and hemolysis occurs and subsequently leads to anemia. And direct parasitic injury during the penetration and occupation of the cells continues to the hemolytic process. Oxidative stress is also possible cause of damage to erythrocytes, which results in increased susceptibility to phagocytosis. And increased urinary methemoglobin level is seen in the cases of Babesia canis because of hemoglobin oxidation. So resultant hemolysis occurs and methemoglobin level increases. And tissue hypoxia is also an important contributor. Many of the clinical signs caused by the most pathogenic Babesia species, and causes of hypoxia are anemia or shock, viscular stasis, excessive endogenous production of carbon monoxide, parasitic damage to hemoglobin, and decreased ability of hemoglobin to offload the oxygen. Hypoxia appears to be more important than hemoglobinemia in damaging the kidney of infected dogs. And lactic acid generation from tissue hypoxia is also occurs because of metabolic acidosis develops in animals with this disease. And respiratory alkalosis can also be found because of to compensate the metabolic acidosis and hypoxemic condition. Multiple organ dysfunction syndrome complications resulting from the systemic inflammatory response syndrome includes acute renal failure, hepatopathy, immune-mediated hemolysis, pulmonary edema, CNS, rhabdomyolysis, cerebral dysfunctions, and renal complications are also associated with higher rate of mortality. Azotemia and proteinuria are also found in dogs infected with Babesia microtype, and the presence has been associated with increased mortality. Next, we proceed for clinical findings. Clinical findings of babesiosis varies from the subclinical infection to multiple organ failure or even up to death of animal. But we can say that clinician can be suspect the babesiosis with the signs of fever, thrombocytopenia, hemolytic anemia, and splenomegaly. This is the dogs having the babesiosis infection, lethargy, anorectic, weak. Babesiosis affected dog having the eye yellowish discoloration of eyeball because of icterus. So clinically babesiosis can be categorized into uncomplicated and severe cases. In uncomplicated conditions, findings may be hemolysis, fever, anorexia, depression, pale mucous membrane, splenomegaly, or water hammer pulses, that is bounding forceful pulse with a rapid upstroke and descent. In severe cases characterized by acute renal failure, CNS dysfunction, icterus and hepatopathy, immune-mediated hemolytic anemia, pulmonary edema, heme concentration, and maybe shock. Various signs with the babesiosis in dog, ulcerative stomatitis, ascites, congested mucous membrane. So in acute cases, symptoms may be hemolytic anemia, icterus, splenomegaly, lymphadenopathy, vomition. In hyperacute symptoms, maybe in the case of Babesia canis rosae, hypothermia of animal, shock, coma, disseminated intravascular coagulation, metabolic acidosis, and even up to death. In chronic conditions, symptoms may be intermittent pyrexia, partial anorexia, loss of body condition, lymphadenopathy, splenomegaly, and sometimes asymptomatic cases. Diagnosis of the disease. Diagnosis of the disease is based on clinical signs and symptoms, based on clinical laboratory findings, and specific diagnostic tests like microscopic identification, serologic testing, nucleic acid-based detection, or molecular genetic detection. Simple protocol for the diagnosis is blood smear examination for parasite, visualization, where we can see the large form of Babesia and small form of Babesia by microscopic examination. Second method is PCR, and third method is quantitative serology by immunofluorescence assay or ELISA. Based on clinical signs and symptoms includes anemia, hyperbilirubinemia, hemoglobin thrombocytopenia, metabolic acidosis, and azotemia and proteinuria are common in dogs infected with pathogenic Babesia species. Second, on the clinical laboratory findings. In laboratory finding, first is complete blood counts. In the dog affected with babesiosis, primarily hemolytic abnormalities are anemia and thrombocytopenia, out of which thrombocytopenia is more common, and sometimes anemia may be absent. And in case of Babesia canis rosae infection, a relatively polycythemia may be noted, and leukocytic abnormalities are not constant finding. In serum biochemistry, pathognomic biochemical changes are not seen with babesiosis in dogs, but some findings like hyperglobulinemia, mild increased liver enzyme activities, and less commonly hyperbilirubinemia, increased burn and serum creatinine concentration may be seen. Urine analysis. In urine, variable signs may be found like bilirubinemia, hemoglobinuria, proteinuria, and rarely cases granular cast. And in some cast, pigmented urea may be seen with the bilirubin and occasionally with hemoglobin. Coagulation testing. Most constant hemolytic abnormality in complicated and uncomplicated cases is thrombocytopenia. And dogs with Babesia coridae infection appears to have altered platelet function test. Specific diagnostic tests come. First test, microscopic identification. Light microscopic examination is highly specific for the identification of Babesia organism, but its drawback is that it has limited sensitivity. It has poor sensitivity, and the presence of organism in RBC is detected by the smear staining with the Jimsa Romanowski field modified right stain used for the supporter diagnosis. However, when microscopic detection is used in combination with the history, single element physical examination, clinico-pathological data, and geographic location, the clinician will become able to diagnose the involved Babesia species. Here the picture of pyriform Babesia species inside the erythrocytes. Other tests are serological tests, out of which immunofluorescent, antibody assay, and ELISA. And molecular genetic detection is done by PCR, which is the most sensitive and specific test. And for the PCR, blood samples can be used for detection of Babesia. Differential diagnosis of the hemoprotozoan diseases. Differential diagnosis can also be suspect on the basis of symptoms which differ in the different hemoprotozoan. Like fever is common sign for the Babesia, Theileria, trypanosoma, and anaplasma. lymph node swelling is generally present in filariasis, but not in babesiosis, trypanosomosis, and anaplasmosis. Nervous signs are generally present in trypanosomiasis, and jaundice is present generally in filariasis and occasionally in babesiosis and anaplasmosis. Abortion occasionally occurs in babesiosis and anaplasmosis. Nasal discharge, lacrimation, pinpoint hemorrhage in conjunctiva are usually seen in cases of filariasis. And hemoglobinuria is generally seen in the cases of babesiosis. So on these symptoms, we can suspect for the particular hemoprotozoan infection. Differential diagnosis with religiosis, rickettsial organism. In religiosis, the thrombocytopenia is common both in religiosis and babesiosis. But in cases of babesiosis, clinical bleeding is not seen, which is present in the cases of religiosis in the form of epistaxis from the bleeding from the nose, scleral bleeding, or hypemia, which are present in religiosis but not in the case of babesiosis. This is the clinical picture of the different hemoprotozoa: anaplasma in WBC, Ehrlichia in WBC, Babesia in RBC, and Theileria in WBC, and Trypanosoma in extracellular in blood. On the basis of their vector, we can differentiate that Trypanosoma is transmitted by mainly biting flies, but Babesia, Anaplasma, Theileria, and Ehrlichia are mainly transmitted by ticks. Pathological findings may be seen with the staining of tissue with hemoglobin or bilirubin, hepatosplenomegaly, lymphadenomegaly, kidney becomes dark reddish in color, and edema and hemorrhages, which may indicate vascular injury and poor tissue oxygenation in severely affected dogs. And in chronic canine babesiosis, the only cross finding may be seen is splenomegaly. For treatment and therapy, dogs generally show clinical improvement within 24 to 72 hours of treatment with anti-babesial drugs, but sometimes in animal, it can take up to 7 to 15 days to respond. Drug imidocar dipropionate is active against Babesia canis, but imidocar dipropionate does not work against the Babesia gibsoni. A single dose of imidocar dipropionate at the rate of 6.6 mg per kg body weight at the interval of 14 days by subcut or intramuscular can be used for the treating the animal, or diminizine aceturate at the rate of 3.3 to 5 mg per kg body weight in 2 applications at the 7 days interval are effective against babesiosis. And in the areas where reinfection is common, some practitioner uses lower doses of diminizine aceturate 2 mg per kg body weight subcut, and this dose completely clear the infection. This approach induces state of premunation. Atvaquinone with the azithromycin at the rate of 13.3 mg per kg body weight and azithromycin at the rate of 10 mg per kg body weight orally can be used for 10 days for the removal of Babesia gibsoni and Babesia cornoidae infection. Other combinations of the different antimicrobial drugs can also be used, like atvaquinone can be used with the clindamycin. Supportive care is based on the patient condition, what laboratory testing and what therapeutic protocol we are using for treating the animal. In supportive care, which includes the blood transfusion, sodium bicarbonate to reduce the acidosis, and fluid therapy can be administered as when indicated. For the blood transfusion is usually indicated in severe, uncomplicated, and complicated involving the life-threatening anemic condition of the animal. For the prevention is important than the treatment, because sometimes treatment become ineffective. So the prevention is the most important thing. Prevention measures alone is sufficient to control the babesiosis in kennels, and the primary means of prevention is tick control. Early detection, that is removal, is important because it takes a minimum of 2 to 3 days of feeding the tick on the same animal for transmission of parasite to the host. means a tick when feeds on an animal for 2 to 3 days feeding, then it transmits the disease to the susceptible animal. Various positions we should take care that around the eyelids, around the collar of the animal, its front legs, back legs, between the toes, and around the tail. We should check the fat for ticks infestation. If tick present, we should use the anti-acariciidal drugs for the removing of ticks, or we can remove these by manually. Dogs should be treated, tested, and quarantined if required before inducing into a new colony. And the use of Amitraz impregnated collars significantly reduce the new infection in Babesia canis or rosae endemic areas. Public health consideration: canine babesiosis species do not appear to pose a significant genetic risk to humans, and the risk to immunocompromised individuals is uncertain. But as with many infectious diseases, people who are undergoing chemotherapy, like in the cases of HIV or have been splenectomized, should take care when handling the blood samples from the dogs. So babesiosis is a rare tick-borne zoonosis of pupil in India, and the majority of infections are mild or asymptomatic, but in some cases it may result in severe illness, even death. And splenectomized people and the old age people, mean more than 60 years of are especially at risk. And no Babesia species has been identified that is host specific for people. In the sylvatic cycle with wild animals, reservoir occur in the nature, and pupils serve as an accidental host for Babesia of animals when they are bitten by infected ticks. So this is all about canine babesiosis. Thank you.
Thank you, ma'am. Audience, if anybody wants to ask any question. Ma'am, there are few queries in chat box.
Okay.
One is from Dr. Naresh Meena. So he's asking that what is the cost-friendly diagnostic methods?
Most common diagnostic method is the staining method by the microscopic examination, which is the most commonly used, and obviously it is most friendly method. But because the sensitivity of test is not so in the research institute or in laboratory where the PCR or molecular detection is possible, so we go for molecular detection. But if because it is not easily available diagnostic tool in everywhere, so we can go for direct microscopic examination.
Okay, thank you, ma'am. Show the periplasma slide. Perioplasma slide.
Sorry?
They are asking to show perioplasma slide. The one writing this question, if you can mention slide number, then it would be easy. By the time, let us take next question. It is by Dr. R. Rishi Keshwan. So he want to ask that which method of GIMSA staining is preferable, rapid or slow method? And what is the concentration of working solution?
Generally, we use the rapid method, but for the good results, we can go for the thick smear. When we cannot found on the rapid method, then we should go for thick smear.
There is one more question. They are asking that currently 4 years dogs suffer from B. gibsoni confirmed by PCR even after giving atvoquinine with doxy. So dog day by day going dull even after 5 days of treatment, while the WBCs goes on increasing day by day. and a dog is continuously sitting on frog posture. So what we can do for further treatment?
In this condition, as we use atovaquone with azithromycin or with doxycycline for 10 days, but because with this, because the side effects of atovaquone, animal become weak and emaciated. So we give the supportive therapy for the animal. Like if it is not taking the feed, we give the blood therapy and we check the parameters of blood. If the animal is anemic, then we go for the hematinic solutions, or we can go for blood transfusion if it is required. Otherwise, oral rehydration and parenteral rehydration is suggested.
Uh, Thank you, ma'am. And one more question is there that can we use tetracyclines as chemoprophylactics as preventive measure?
In the case of babesiosis, some practitioners use tetracycline as prophylactic also and chemotherapeutic, both purposes. We can use it, but uh, better to we use lower dose of mm,
Okay, ma'am. Then next question is that specifically preferred or restricted diet of dogs in babesiosis.
it is depends on the condition of the dog, how much infection in his body, or what is the status of the animal. As I told you that the pathogenicity of the disease or babesiosis is depends on the various factors, also on the which species of babesia or strain of babesia is involved, and what is the immune status, age status of the animal. If animal is in good condition, then we require less supportive care. But if animal is in debilitated condition, in aged condition, then we require more supportive care. It is depend upon the condition of the animal. Accordingly, we have to suggest for the supportive care.
Okay, ma'am. And next question is by Avinash Mina. He's asking that, ma'am, is there any zoonotic case of canine babesiosis detected from India?
From India, it is not reported, but in abroad, various cases are reported from the Babesia microti, Babesia divergence. But in our country, in my knowledge, no cases reported.
Okay. Next, by Sharda. So, ma'am, want to ask that is any vaccine available for babesiosis?
For the Babesia canis pyrodog vaccine is available, but it is available in abroad and not in India. But this vaccine also against work only against the Babesia canis, not against the cross species of Babesia.
Okay. Ma'am, one question from my side also. Uh, as we see in case of malaria, so the case comes like in case of sickle cell anemia, very advantage that people don't get sickle cell anemia. So is there such kind of advantage in case of babesiosis also?
In babesiosis, anemia is not a constant finding. Here, thrombocytopenia means decreased number of thrombocyte is more common. But as the hemolysis occurs, then it is usual that anemia also occurs in the cases. But sickle cell shape of the RBC do not become sickle shape. So the oxygen carrying capacity of the RBC is not decreased as much in the case of malaria, in the case of babesiosis.
Okay, thank you, ma'am. And okay, one more question is there. Is there any relationship between babesia and hind paralysis in babesia infected dogs?
Some cases of babesiosis, we have seen the paralysis, but there is no confirmed literature available on this relationship between the babesiosis and hind leg paralysis. It is more common in the case of trips.
Okay, ma'am. Thanks a lot. And the audience is also asking that if you can share your PPT with them.
Yeah, I will send the organizers, they will share.
Okay, ma'am. Thank you so much.
Thank you so much. Once
Thanks a
again,
lot
I
for
want to
taking all
thank.
the queries and your knowledgeable lecture also.
Once again, thank you from my side to the organizer for inviting me on this wonderful platform to be present. Thank you. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Our next guest speaker is Dr. Biju Chakao. He is Associate Professor and Head of Animal Nutrition Department from College of Veterinary and Animal Sciences. Before inviting Dr. Chakao to deliver his lecture, I would like to briefly introduce Sir to our participants. So, Dr. Biju Chakao is native of Kerala. Sir completed a BVVSc and AH, his master's and PhD in animal nutrition from the College of Veterinary and Animal Sciences in the years 1996, 1998, and 2015, respectively. Sir is a recipient of gold medal for MVVSC, scoring the highest marks among students belonging to all the disciplines. Sir worked as a veterinary surgeon in the Animal Husbandry Department, Government of Kerala, for 6.5 years before joining as a faculty at Kerala Veterinary Animal Sciences University and working there for last 15 years and 8 months. Sir
Some problem in my system.
Author of
Kindly try to
158
share the video.
publications, comprising of 60 research articles, out of them in NAS-rated, peer-reviewed, referred journals, 12 book chapters, 35 conference papers, and 47 popular articles in various farm magazines in Malayalam, plus 4 leaflets authored and published by Farm Information Bureau, Agriculture and Farmers Welfare Department, Government of Kerala. Sir has delivered several keynote addresses, handled technical sessions in state level, and Biju sir has conducted 12 radio talks through All India Radio and has also done several question answers sessions for farmers through radio. Sir has guided 10 masters and one wildlife student as a major guide and 20 masters and 5 MS wild students as minor guide. Currently, he is guiding one master's and one PhD student, each as a major plus, 6 MVVSC and 1 PhD student as minor guide. Sir is associated with 7 different plant projects as principal investigator, co-principal investigator, coordinator, the most notable among them being the post of co-coordinator of National Agricultural Innovation Project titled Multi-Enterprise Farm Models for Addressing the Agrarian Crisis of Wayad district of Kerala, funded by ICAR with total outlay of 6.23 crores. Dr. Biju Chakao sir is editorial and advisory member of the Indian Journal of Pure and Applied Biosciences, an open access peer-reviewed online journal with a NAS rating of 4.55. He is also associated with several project preparation and group discussion sessions organized by several NGOs such as MS Swaminathan Research Foundation and different local bodies in Kerala. He is also visiting faculty of State Bank and Training Institute, then Livestock Management Training Center, Kannur, and also in several districts of Kerala. Sir has taken nearly 200 odd classes for farmers, workers, and entrepreneurs. Sir has also provided advisory services to more than 6,000 farmers over telephone, field visit, and also in person. Sir, I must say you are truly an inspiration for all of us. We are eager to hear you, sir. Kindly enlighten us. Over to you, sir. Okay, so our speakers will take some time as there are some technical faults. By the time, let me once again introduce you all to Vital Biotech. So Vital Biotech is India's leading publication, research and training institute whose goal is to tackle the world's most pressing problems which are related to food and agriculture. In order to achieve this, it is actively involved in creation and manufacture of microbiological and biotechnical substances and molecules, gaining respect both domestically and globally in the field of scientific publication. Vital Biotech aims to publish top-notch, progressive, peer-reviewed research articles, whereas Agriculture Forum for Technical Education of Farming Society quota serve as a spiracle between the network of rural communities in India and other stakeholders, such as government, development organizations, and corporate entities. It is a spherical organization of agricultural professionals and related to the sectors in India. It provides a common platform for agriculture professionals like professors, associate professors, PhD scholars, students, experts, and researchers working in various scientific institutions across India and abroad. So I am introducing about them because they are the organizers of this event.
Hello, good evening to all of you. I am audible.
Audible, sir.
हेलो कोई बात नहीं बताइए
Good evening to all of you. Sir, I am audible.
Yes, sir, you are audible.
Audible. तो मैं आपको एक नंबर फोन डालती हूँ.
Sir, please unmute. Who is this? Okay, good evening to all of you. Myself, Dr. Dharmesh Tiwari, Assistant Professor in Department of Animal Nutrition, College of Veterinary Science and Animal Husbandry, Acharya Narendra Dev, University of Agriculture and Technology. Welcome to all. I think this is a great training for all of you. All viewers, you can see, we have the renowned scientists and speakers in this training. Within 7 days, you can learn a lot. Learning is everywhere. Knowledge is spread in everywhere. We can catch it. So I am thankful to our society. He provided a platform for our viewers, students, PG, PhD students, by which we can gather the knowledge in different fields. Here we are different type of speakers like animal science, veterinary science, and different universities. So within 1 minute, our next speaker will be joined. There is so some technical issues. So everything we are known very well that in the online session, these technical issues are going on. So let's try to go forward. Here we can discuss a new technology about the animal nutrition field. Here our one speaker is presenting the PAN, Precision Animal Nutrition. What is the precise animal nutrition? He will discuss later on. But today we will discuss about the bypass technology. It is a new technology which is used for the animal feeding and nutrition. Bypass technology, it means it is used for a very high yielding animals. Generally, this technology is not used for normal animals because here we bypass some nutrients. It is especially for the ruminant, not for monogastric animals. It is especially for the ruminant. When we provide the nutrient in this technology, bypass nutrient, or we can say that is the protected nutrients, which we provide to our dairy animals for providing directly to the animal body to bypass the rumen microbes, because they degrade the proteins and fats, which is harmful for the rumen environment. So if we provide the nutrient which bypass without affecting the rumen environment and directly go to the lower tract of the intestine and digest there, so nutrient available for the animals for their production, for growth or other purposes. Yet this technology is used by two methods mainly. Bypass proteins and bypass fats are available in the market. Bypass proteins are mainly made up by the covering, by using the natural ingredients like tannins and covering of some protected proteins that like fatty acids, And several other methods are available by which we can form the bypass protein. Same as a bypass protein, we can also form the bypass fat, where we form the calcium salt of fatty acids, covering of protein, protected proteins, formaldehyde proteins. These are the different techniques. So in coming years, or you can say in present scenario, it is very useful. So our next speaker has joined, and I think technical issues has overcome. So I welcome. I am ending my speech here, and I will discuss later on what is the bypass protein in detail. So please, all viewers, we are ready. Dr. Anil.
Sir, am I audible, sir?
Yeah, you are audible. Your slide is seen. Please go for full screen, F5 or something. Yeah, it's nice. So start your presentation.
Yes, sir, sure.
Yeah. Welcome, Doctor.
First of all, sorry for the delay. Good evening to everyone, all the members involved. All the members which are directly or indirectly linked with this in organizing this wonderful training and workshop program for a duration of 6 or 7 days. And second, and finally, so my topic for the today's presentation is CT scan and its application in animals. Basically, first coming to the introduction part. First coming to the introduction part, all the medical imaging modalities rely on the interaction of the tissues with X-ray photons or the ultrasounds or the radio frequency waves. Now coming to the word tomography, which is derived basically from the Greek word tomos means slice and graphy means to write. And the CT image are only made possible with the help of the computer. And what the computer does is it uses the complex data and changes it. What it does is the complex data is digitizing continuously analog signals is a process by the analog to digital conversion. So about the history, it was commercially. Coming to the history, it was commercially viable CT scanner was invented by Sir Godfrey Hounsfield in Hayes, UK at EMI Center Research Laboratory using the X-ray. And the CT scan mainly consists of a gantry alignment light, patient guide light, the X-ray exposure indicator light, the emergency stop button, the control panel, external light alignment light, and patient couch and an ECG gating monitor which is attached to it. Now coming to the phases of the CT imaging, it has following phases. First is the data acquisition with the help of tube and detector movement, and multiple attenuation measurements are taken around the object. The scanning of the patient is done and the image construction is done by the process which is known as back projection. The image is created by reflecting the. Then comes the image display process, and after the image display is completed, the last step is the image archival or record. See here, the CT slice is done, and the following components are there, which is the pixels and the voxels. Now, what is a CT scan? What a CT scan does, it produces an axial section cut or slices. The CT image is recorded through a scan. The scan, which is made up of multiple X-ray attenuation measurements around an object, and the X-ray is passed and it is detected by the help of detector. Now, sir, am I audible and visible, sir?
Audible.
Yes, you are audible and visible both.
Sir, are the images visible, sir?
No, image is not visible, Dr. Sir.
Sir, that is what the problem is, sir. I'm unable to see the images here too.
Okay, no problem. Let's go. If image is
Sir,
not shown.
actually, sir, images are important, sir. Actually, that is why it is important to show, sir.
In last, you can share your PPT. Okay. So let's discuss
Yes, sir.
something.
So what it consists of is a cross-section portion of a body scanned by the production of CT images, which is called as the slice, and the image are represented as matrix of number. And the matrix is a two-dimensional array of number arranged in rows and columns. And each matrix represents a three-dimensional volume element in an object, which is called as the voxels. After all the measurements are done, the measurement have been back projected into the matrix and all the pixel values are determined, the image is displayed. So coming to the next part, which is this effect of the slice thickness on the resolution, whether this slice thickness should be large or thinner. One should prefer a thinner slice thickness because in the large slice thickness, in the larger slice, the object of different shape and opacity are averaged because they reside in the same slice, and the resolution of an object is of intermediate shape and opacity is there. While in the case of thinner slice, the same object will reside in the separate slices and the shape will be unique, but still the slight of opacity is there. Now, coming to the positioning of the animal, for the head and the cervical spine, the external recumbency is preferred, while that of the thoracic, lumbar, and the lumbosacral region, the dorsal recumbency is preferred. Now, Hounsfield unit system and the CT number. CT gray level. First, coming to the CT gray level, by calculating the difference in the intensity of the X-ray transmitted to the patient and that to received by the detector, the computer of the CT scanner can measure the X-ray attenuation of these tissue scanned, and the X-ray attenuation of the tissue within each voxel is depicted as a variation of light intensity on the monitor, and these variations are viewed as black, white, or it can be of gray shades. And by using the region of interest, that is the ROD technique, a numerical value of attenuation relative to water known as the Hounsfield unit or the CT number may be obtained. So the CT number can be calculated by the help of the formula or equation. You can say it is 1000 into, sir, it has an image showing the formula, 1000 into the attenuation, that is the mu object minus mu water divided by mu water. Here the mu is the attenuation coefficient. The another way for the resolution of the image is by changing the area of the tissue that has to be imaged or the field of view. If we narrow the field of view, large number of voxels are applied to the smaller region without changing the absolute voxel in the matrix, thus allowing better discrimination of the tissue. And it is a very good way in order to resolve the small structure such as the spinal cord of the dog and the cat. Now, here is the image showing the CT value. like that of the white matter, it is around 30, and when the contrast is used, it is increased to 35. For the gray matter, it is 35. For the cerebrospinal fluid, it is about 6 to 10. Hemorrhage and blood volume, it is around 52. For the blood clot, it is around 50 to 80. For the plasma, it is 25, and for the water, it is 0 itself. Now, coming to the next part, which is the windowing. Windowing, which is also called as the gray level mapping or contrast enhancement. Now, coming to the window, it is the range of the CT number that will be displayed with the different shades of gray ranging from black to white. The windowing, which is a process which is windowing is a process which is used for process of using the calculated hospital unit in order to make an image. The brightness of an image is adjusted via the window level, and the contrast it is adjusted via the width level with the help of the window width. Now, setting up the upper and the lower gray level calculation. Okay. Sir, I have connected through other one, if I can share it. When presented with window width and width level, one can window level, one can calculate the upper as well as the lower gray levels. The value over the X will appear as white, and while that of below the Y, it will be appearing as black. And the formula for the calculation is window level plus window width divided by 2 for the upper gray level, and for the lower gray level it will be window level minus window width divided by 2. For the typical window width W and the level L values for the head and neck. In the case of head and neck, for the brain it is 80/40. For the subdural space, for the subdural it is 130 to 350 to 100. For the temporal bone it is around 2800 to 600. The soft tissue it is around 350 to 400, and the L is about 20 to 60. For the chest it is 1500 to 600. For the mediastinum it is about 350 to 50. For the abdomen, in the case of abdomen, for the soft tissues it is 400 to 50, and for the liver it is 150 to 300. And in the case of spine, soft tissue it is about 250 to 50, and the bone it is 1800 to 400. Now, coming to the next part, that is the spiral CT scan. Now, the X-ray machine scans this X-ray machine scans the body in a spiral path. This allows more image to be made in a shorter duration of time. The spiral CT also creates more detailed picture and may be better at finding small abnormal areas inside the body. The electron beam CT is particularly useful for the functional assessment of the heart because it provides qualitative and quantitative evaluation of the cardiac and myocardial perfusions. Now, in the case of small animal, we can use contrast agent, and non-ionic iodinated constant medium is used, and they are administered at the rate 400 to 600 milligram iodine per kg of body weight. And the contrast medium is usually injected into the cephalic or saphenous vein, while in the case of small animals, the jugular vein can also be used. It can be done manually or can be done with the automated injections at the rate 1 to 3 ml per second administration, depending upon the volume. When the contrast medium is administered, the scan can be delayed for a few seconds or minutes, depending upon the cardiac output and the heart rate. So it was an image showing the animal in external recumbency, which was undergoing, and here it was simply the positioning of the animal with the help of velcros, and restraining was done. the skull and the neck and the forelimb are needed to be wrapped around in order to avoid the streak artifact during the respiratory movement. And it is important to sedate the animal when undergoing the CT scan, and the mechanical ventilation is required so that the apnea, which is mandatory for performing the CT, can be done and the quality of the image is better. And for next, in the case of small animal, except for the CNS, the CT usually represent the second level modality for studying the skeleton, particularly the axial one. And the for the skull, mainly MRI is used, but still the CT can be used for the new brain and for any kind of developmental or inflammatory or degenerative or vascular disease of the brain. Now, here you can see the CT image of the osteosis. Here you can see it is showing the hyperosteosis of the lateral wall of the left frontal sinus, and here you can see the soft tissue rim, and in the other, that is image B, you can see the lysis of the lateral aspect of the frontal bone. Now, here you can easily see it is a three-dimensional CT of nasal squamous cell carcinoma in the case of the cat, and it is showing the aggressive osteolytic activity lesions involving the premaxilla, the nasal bone, and the frontal bone. Now, computed CT is widely used in small animal in order to study the external middle as well as inner ear abnormalities, and these are characterized by attenuation of the tympanic cavity. It can be, there can be a thickening or lysis, and the image which is not showing it contain a transverse CT of the tympanic bulla, and here we were able to see the small bone lysis as well as the periosteal reaction. Now for the spine, MRI is basically done, but CT can also be used in order to show the injury conditions of the spine, which can be due to any kind of trauma, congenital bone malformation, or spondylitis. And here was an image which was showing multiple hemivertebrae and butterfly vertebrae at the thoracolumbar tract. Now, here it was an image which was showing the intervertebral, that is IVDD type 2, that is also IVDD disease in a 10-year-old male German Shepherd dog. And there was a history of and the two intervertebral disc protrusion was seen, and the compression was seen at the level of L1 and L2. Now, here you can easily compare the conventional X-ray with that of the CT. A ventrodorsal view was taken, which is shown in image A, and in this you can see there is a loss of the loss of the left articular process in this, which is not much demarcated, but when we go to the of the vertebra. Now, for the skeleton, now coming to the skeleton system, it is usually used for the hip dysplasia. It is used in the case pulmonary vascular embolic condition. Hello.
Yes, sir.
Hello.
Audible.
Am I audible?
Yes, sir. Now it is audible.
Okay, thank you. In the case of the or any kind of embolic disease, including infarction and the lung lobe torsion, while in the case it is and it is also used in the case of mediastinal masses. The most common which are seen in the case of dogs and the cats are the lymphomas and the thymus. In the abdomen, coming to the abdomen, it is mainly used for the characterization of the large masses and the pelvic diseases, where the radiography and the ultrasonography are usually inconsistent for the assessing their spatial relationship. The CT can be used. It has been also used for the congenital intrahepatic and extrahepatic shunts, arterioportal fistulas, and multiple acquired portosystemic shunts are well recognized on the post-contrast CT. Computed tomography, it is also used for the evaluation of the gastrointestinal diameters as well as for the wall thickness measurement. The adenocarcinomas, which appear as a thickening and hyperattenuating wall with strong contrast enhancement. On the other hand, the lymphomas, which appear as sorry, hyperattenuating and exhibits low contrast enhancement. Now, it is also canine pancreatitis. Pancreatitis is a common condition which is seen in the case of dogs, and CT, which has emerged to be a valuable tool for the diagnosis of this problem. And in the dog, the CT is indicated for diagnosing and staging of the neoplasia of the female genital tract. And in the case of males, it is restricted to that of the study for the prostatic glands. Now here it was an image which was showing the hepatocarcinomas with comparison to that of the pre-contrast and the post-contrast. And with the post-contrast, it was much, it appeared like hypodense mass and irregular enhancement was there. Now coming to the artifacts which is usually seen in the case of the CT scan, it involved the ring artifact, the noise artifact, the beam hardening and the scatter, and the motion artifacts. First, coming to the ring artifact, which is caused by the defective or miscalibrated detectors. It creates circle-like structures, and the bright and the dark center rings are present on the center of rotation, and it can be fixed by recalibrating the detectors. Now, second is the noise artifacts. Noise artifact is it simple means the unwanted change in the pixel values that hinders the picture quality as well as the contrast resolution. The CT is measured via the SNR, which is signal to noise ratio. The higher the ratio, the less will be the noise present in the image. It can be due to the statistical error of the low photon count, which is influenced by the, it can also be due to the excessive thickness of the area which is to be scanned, and it creates random thin and bright or dark streaks. The other factor is the low MA and the KV, and it may be also due to the poor positioning of the patient. Here are the factors which affect the noise. First is the MAS. The MAS or the dose of the CT scan has a direct relationship, and it can twice the MAS. It increases the SNR by 40%. Increasing the dose of the scan will decrease the amount of the noise and hence will improve the contrast resolution of the image. And coming to the second point, that is the patient size. Larger the patient size, larger it will absorb the radiation, meaning the fewer of the photon will reach the detector, hence reducing the signal to that is the SNR. Now the beam hardening and scatter. These are both are different mechanism, but both produce a streak between the two highly attenuated objects, such as the metal, bone, or attenuated contrast of barium. Now the second artifact is and the third one is the streak artifact, which appears as the dark band or streak between the dense object in the image. And metal deletion technique can reduce this artifact, or it can also be reduced by increasing the kV, because after increasing the kV, the penetration to the high density object is increased. Now coming to the motion artifact mainly for the patient, it may be due to the patient movement, or can be due to the movement of the organs such as cardiac or respiratory or bowel, which causes the blurring of the image, as well as long range streaks. The faster scanners can be used, such as the spiral one, can be used in order to reduce the motion artifact, because the patient has less time to move during the acquisition. Now coming to the advantages and the disadvantages of the CT. First, coming to the advantages, it is quick and painless. It can show up the acute bleeding, as I told you, that can be used for the thrombus also. And if any kind of vacillation is present, it has a good visualization of the bone structure, as well as for the calcified lesions. The filters are used between the patient, as well as in between the patient as well as the machine, in order so that a sharp and smooth image can be reconstructed. The raw data may be reconstructed post acquisition with a variety of filters. Now coming to the disadvantage part, it needs there is a need for a quality detector and a computer software. Patient get exposed to higher radiation, which can lead to tumor formation. And there is a risk of ionizing radiation and attenuated contrast agent. And coming to the future aspect, an equal important and expanding use of CT in veterinary medicine, and it can be used for the image creation, that is can be used for the 3D reconstruction, and the image and the 3D reconstruction can be an invaluable teaching technique. And the last slide was
Okay, thank you, sir.
Yes,
Thank you
ma'am.
for the valuable lecture. There are few questions in chat box. Dr. Arpit is asking that CT scan facilities in India in animal treatment. What are the CT scan facilities in India for animal treatment?
Coming to the CT scan facility is actually very less it is used here, but it is nowadays coming into trend, the use of CT. But recently now people are moving towards MRI, because MRI is used more for the spinal injuries as well as for the brain, but they are using it.
Okay. Another question is from Dr. Naresh Meena, that is it safe for animals if many time we perform CT scan?
Actually, it is not safe. For 1 or 2 times, you can easily use it, but as we need to sedate the animal, and there is a exposure to higher radiation, so one cannot say ki if you are exposing the animal for many times, it is safer to it, but one can if it is needed.
Okay. And what are the various institutes or organizations from where CT scan techniques can be learned in India?
Recently, coming to this topic, it has been used in the private hospitals as well, and coming to the institutional, it is available, I guess, in Jabalpur recently, and in Bikaner, I guess it is available. In Tanuas, it is available. There are few institutes which are usually performing it and using it.
Yeah, and I think on Google also, audience can get more information if they want
Right,
for a
right.
specific state. Next question is from Dr. Rajkumar that CT scan can cause tumor or not?
Yes, it can if the exposure to the tissue is too much. It can cause, as I told you in the last slide about its disadvantage, the radiation can affect.
Okay, thank you, sir. And audience is asking for PPT, so definitely our
I
speakers
will
will share
definitely
with
share it because
organizers.
the images. Yeah, sure. Actually, the
Yes,
images were there which would have made this presentation more nice, but
yeah,
unfortunately, the images were not visible.
yeah. This is the drawback of hybrid mode. Sometimes it happens. There are technical glitches,
Yes,
but
ma'am.
okay.
Yeah.
Thank you, sir. Our next
Okay.